Welcome everyone. Just some announcements before we get started. I'll be your moderator today. My name is Crystal Smith and I work at the University of Northern Colorado and I'm a part of the NoCo healthcare sector. Some rules or just some things to consider. The audience will be on mute, but there are opportunities to ask questions via the chat function. So just type in those questions and they'll be addressed throughout this panel discussion. And you could also raise your hand and we can unmute you if you do have a question at certain points of our panel discussion. And then just as speakers, if you could just give brief answers to questions so that we can get through a lot of questions throughout today. Thank you all for attending. Welcome. This is our second NoCo Healthcare Sector Live virtual chat. And our focus today is on healthcare internships, apprenticeships, work-based learning in Colorado. This event is hosted by the Northern Colorado Health Sector Partnership, which brings together key stakeholders to promote and improve health within our communities. With industry at the forefront, we collaborate with education, workforce development, economic development, and other community partners to seize opportunities, respond to changing healthcare environments, solve collective problems, and celebrate successes in our region. And to get started today, we've got some great panelists with us. So panelists, if you could introduce yourself, where you work, and your occupation or role within your organization. And we'll go ahead and start with Katie. Katie, if you can start us off.
Hello, my name is Katie Oberturf. I am the Program Director for Sterile Processing and Surgical Technology at Ames in Greeley, Colorado. And I am also a surgical technologist at North Colorado Medical Center.
Thank you, Katie. Thank you for being here. How about you, Erin, if you want to introduce yourself?
Yeah, I'm Erin Miyoshi, and I'm the Program Coordinator for Surge Tech and Sterile Processing. I work with students or prospective students who are looking into those fields and then help get you onboarded to clinical sites and to clinical sites once you are in the program, making sure you're compliant and we've done everything on our end that needs to be done so you're successful in those internships. So welcome.
Thank you, Erin. Anna?
I am Anna Young, and I'm a recruiter at UC Health, and I recruit system-wide, so from Northern Colorado to Colorado Springs.
Thank you all again for being here. So our first question is, what does work-based learning, so internships, apprenticeships, observations, clinicals, look like in your field? And Katie and Erin, if you want to start us off, giving some information about that in your field.
All right, so for sterile processing, the students attend 400 hours of clinical. They usually go Monday through Friday, but they can be various different shifts, 12 hours, 10 hours, kind of just whatever the facility has available and based on their preceptors scheduling, that way they get the best education and experience possible. And for surgical technologists, they go until they complete 120 cases. AST, which is the Association of Surgical Technologists, tells us how those 120 cases need to break down. So they have certain requirements that they have to meet. So we usually send them out to clinical for about 11 or 12 weeks, Monday through Friday, 7 to 3:30, and then we make sure they meet all their requirements.
Thank you, Katie. How about you, Anna, from your perspective as a recruiter, what do internships, apprenticeships, observations, clinicals look like at UC Health?
So the internships and the clinicals, they are usually handled within the department themselves. So whatever area that you want to have your clinicals at, you would contact the department. If you needed a contact, I mean, you can always talk to a recruiter and we can find out who the contact is. I know that there's several departments that have a main email address that you can email and get information on that, but that's as far as, you know, for clinicals and observations. We do have a volunteer and shadowing programs that you would sign up through the volunteer department. I think they're on hold right now because of COVID, but you can always contact the volunteer department for each hospital to see if you are able to, you know, have a shadowing experience. And then of course, then we have some residency programs for some new grads for nursing, respiratory. We also have a business administrative fellowship and also some athletic training residency program. And that would be after you have graduated.
Great, thank you.
Mm-hmm.
So our next question is, what advice would you give to students interested in gaining experience in your area? How can they try it out or gain skills?
So I would definitely suggest that you find maybe a program that is near you and go observe for a day, or just ask if you can participate in some of the skills drills that they do, just to get an idea of what you will be doing, what you'll be seeing. And also, like Anna said, a lot of facilities offer shadowing. So that's also definitely another great way to get a real life version of what you're actually going to be doing. That way you have an idea of what it is before you enroll.
Great. Perspective from recruiting, or Erin, do you have a perspective as well?
We have sent students, I'm also the program coordinator for RadTech, but we have sent students before to UC Health and to Banner sites through their shadowing program and directed them that way. It's a fairly simple process in getting students going, obviously on non-COVID years. So it's a fairly simple process. So I would kind of say exactly what Katie did and what Anna did, and state that students should be looking at those sites. I think Longmont United also has a shadowing program to kind of go spend a day in the thick of it, see if that's something that you want to do.
Great. So kind of to follow up with that, I know a lot of students don't know where to look. So it's great that there are job shadowing programs out there, but for those students who are having issues trying to connect with professionals in your field, what's some advice that you would give them on how to connect and how to engage with your industry?
I will start. Anna mentioned that you go on, well, she didn't say go onto the website, but when you go on to the UC Health website, there is a volunteer tab, and that's where the paperwork is located. That's also where it's located for Banner as well. You go to that volunteer tab. They have paperwork and who to turn it back into, who the department heads are, if you need to get a badge or parking or whatever prior to that day. So they have specific things there. They might have immunization requirements. They might, if it's during flu season, require that you have a flu shot. You know, masking right now, obviously, or going through those screening protocols. If you take students, every facility has something different, but that volunteer tab is a good place normally to look. And then I would also look on every website right now has some sort of COVID-19 information on what's going on at their facility and how they can do that.
Thank you, Erin. Anna, anything additional from your perspective?
Yeah, and Erin just covered it, so yeah.
Perfect. Great. Katie, how about you? Any additional comments?
No, I think, yeah, Erin nailed it.
Perfect.
And Crystal, Lisa has joined us.
I see. Lisa, welcome. You give an overview, just introduce yourself, talk about your role and your organization.
Can you hear me okay?
Yes.
Okay, good. My name is Lisa Allworm, and I'm a speech language pathologist with Columbine Therapy Services. And we are a long-term care and rehabilitation provider in Northern Colorado, Fort Collins. And so I work with seniors for people who live here permanently as long-term care residents, and I also work with short-term rehabilitation patients, people who come in for little old ladies who have broken their hip and are a little confused after anesthesia, or people who have had strokes or Parkinson's disease or multiple sclerosis, swallowing disorders, cognition, speech and language. I think that about covers it.
Well, thank you for being here. One of the questions that we were discussing is about what advice you would give to students interested in gaining experience in your area, and how can they try out or gain skills?
Oh, I think asking to volunteer if they're interested in a nursing home setting, coming and volunteering at a nursing home, or asking a therapy team if they would be willing to have them shadow for a day or so. That's a great place to start. It gives you just a feeling of what it's like, a day in the life of a therapist. That's probably where I would start.
Great, thank you. So our next question is about tips. So what are some tips that you would give students on how to make the most of their work-based learning experience?
I would say, show up every day, be there, be in the moment, take that constructive criticism that you receive from your preceptors and work on it, reach out to your instructors if you need to. Don't ever be afraid to speak your mind and ask for help when you need it. I think that's extremely important, because sometimes when you do get in the thick of it, it can be a little overwhelming, or you don't quite understand something that someone is asking you to do, and going to your instructor and getting clarification can always be a huge help. But I think the biggest thing is to just show up and be there every day.
If I can add to that, a lot of times you gain these skills by going to school for surge tech or sterile processing or speech language pathology or whatever. But employers are also looking for soft skills, and those are skills that we don't teach in the classroom in surge tech or sterile processing, but they're vitally important. So as Katie was saying, show up on time, be eager to learn, be a team player, have great communication skills, look people in their eye, put your phone away, just all of these things, that we don't necessarily teach in the classroom, but that will help you find a job after, if during your clinical time or your volunteering, that you're there and you're present and you're eager to learn and you have some of those soft skills. That's really important.
Thank you. Lisa, any advice?
Oh, ask lots of questions. Don't be afraid if you don't know the answers. Be willing to try to get a little creative and try things as well. Anything that you've learned in school that you want to pull on over and actually try in real life with a person. I think it's wonderful. I think the best students I've ever had are the ones that were really willing to just get in there and get working with the people right off the bat, and not sort of stay back and wait. So it's hard to go wrong, actually, when you're engaging with patients.
Thank you. And Anna, Erin mentioned soft skills are those transferable skills. Can you talk from a recruiter perspective of what skills you're looking for when you're reviewing or resumes, applications? What are some of the things that you look for as it relates to work-based learning?
Yeah, so, and following what everyone is saying is that, this is your first impression. If you're volunteering or shadowing a department, that's your first professional, experience to contact with someone. So you want to show them that you are dedicated. This is what your passion is, that, patients do come first, and you have that compassion, that you're a good listener, a good communicator. So some of those are the skills, and then, being a team player, hard worker, but yeah, and don't be afraid to ask questions. And some of our managers who do hire new grads, that a lot of times they hire that new grad because they showed that they are willing to learn that specific area, and sometimes even going into that interview and showing that eagerness of learning has gotten them the job, and they're dedicated to being in that profession.
Thank you.
Crystal, I just had a follow-up for Anna.
Definitely.
When a lot of our speakers were talking about volunteer opportunities, can you talk a little bit about when you are reviewing a resume, what do you see when you see that students have volunteered in the healthcare area? How does that influence your decision in hiring?
The hiring managers, I think it just depends on the hiring manager itself that's reviewing the applications. But I think, doing the volunteering, I think that does help, that that student has gone in and they have gone in and experienced that department. And especially if you are volunteering in that department that you're applying for, and getting your face in and getting to know that manager, I think that helps even more to volunteer within that department or area that you want to be in, because you've already started that networking.
Great. That kind of leads into this next question. So thank you, Chris. Thank you, Anna, for that. This is about networking or building relationships. How did you build your network or relationships within your industry? And what are some tips you have for students who are currently doing that and trying to explore your field?
I would say definitely talking to the staff that you are working with. Being a team player goes a long way, and they will let you know if certain places are hiring, or they may know someone that's at another facility that is looking for a tech of some kind. Definitely, working hard and, having all of those soft skills, people definitely notice that. And you are basically on a 3-month interview, essentially. And the more of a team player you are, and, talking to people, sitting in the break room at lunchtime and interacting with the group is a great way to meet new people and just kind of, spread out the people that and getting to know other people at other facilities. And everyone knows someone in this business. So, and people, they travel a lot. So you may know someone who travels to other states, and, they can give you tips on who's hiring or looking for someone.
Thank you, Katie. How about Lisa? Do you have any tips, or how did you build your network?
Well, as a student, when you first start off, you start off with an internship. And so I think you definitely start those relationships just within an internship. Usually there's a school setting, and then there's also a medical setting that you do for your internship. once your internship is over, you start a clinical fellowship year, which means that you are hired at a facility, but you have a mentor who basically reviews your work, goes over your paperwork, mentors you essentially for a full year before you become a full clinical therapist. So having a good relationship with whoever is going to be your clinical fellowship director, that's key. Now, when I got my job here at Columbine, I actually started off as a PRN therapist. And that was very nice because I was able to go to several different buildings that they had and see and get to know therapists in several different teams. And then I ended up, from that opportunity, I ended up covering a maternity leave, which put me in a building for 3 months. And then I covered another maternity leave. And then from that maternity leave, I was offered a full-time position. So at another building that opened up. So sometimes having that kind of flexibility for starting off is a good way to just get integrated into the system.
Definitely. And Lisa, PRN, can you explain?
Oh, what does that stand for? Per diem? Per diem employee. So it's somebody who's an on-call person. So I would have my name on a list and people would call me if they were sick or if they wanted to take a vacation or they were just had a very large caseload and they needed some extra help for a couple of days. And so they just call me, and if I was available, I would go on over and help out.
Thank you. Chris, do we have any questions in the chat?
I had one question about apprenticeships. We had a student that is interested in sterile processing with UC Health and Banner. And I don't know, Katie, if you want to start with that, and Anna, you may know a little bit about it. I can follow up with some comments, but Katie, you want to take that?
Yeah, so Banner Health does not currently offer apprenticeships for sterile processing yet. We are working with them to get that program started with apprenticeships, but currently we do not.
And Anna, I know I personally have had several conversations with UC Health that are exploring it. I don't know if any of that's filtered up to you yet.
You know, I don't recruit for sterile processing, so I'm not aware of any apprenticeships that we have. But I can certainly follow up with the recruiter to see if they know anything.
Okay. Anna, I'll hook up with you via email afterwards, but I do know that UC Health is looking at it. Originally, we were working with the Longmont facility and the Broomfield facility, but I know that there is a strong demand for sterile processing techs, and it is something that many of the hospitals are looking at apprenticeship opportunities. So Kelsey, I'll put my email into the chat box too, that I can follow up with you about more specifics on apprenticeships. And then hold on, one question here for Lisa. I'm a current grad student in the SLP program at UNC who's interested in working in rehabilitation with adults in the geriatric populations. Do you know if long-term care facilities are currently taking graduate student interns, or has that been put on hold due to COVID?
That had been on hold due to COVID, and I'm not sure when they are lifting that restriction. Actually, Joyce might be able to answer that question.
Hi, I'm Joyce, HR Director. How are you guys today? We are definitely opening up more on the internship opportunities, and I know that the Director of Therapy that manages all of the disciplines is considering internships, and more than likely we'll be opening up this summer into the fall. This springtime, we've been going slow at that process based on vaccination requirements, et cetera. And so we will be probably moving forward with opening up slots. So if anybody's interested, definitely they can send it to me, and I'll put my name, or Chris can put my email address in the chat for everybody to grab. Cool.
Yep, that's all, Crystal, right now. Thank you.
Thank you. And kind of as a follow-up for Anna, are there any work-based learning opportunities currently available at UC? Are there any restrictions due to COVID based on that? And just kind of giving that awareness to our listeners, I think would be really beneficial.
Yeah, I think they're starting to lift some restrictions, but as far as internships and stuff, I'm not sure what the status is on those. I know, when COVID started happening, they were hiring for clinicals. They were actually hiring people as advanced care partners, so that they were actually be our employee, because we couldn't take in a volunteer or someone with clinical. We still have those positions available. They're called advanced care partners. Those are mostly for RNs, if anyone's interested in RNs. And that's really someone who is in the BSN program, and they can come in and work as basically as a CNA, but then to get your experience. And they would be working as PRN, so work as needed. But that would be something that for any RNs that are on the chat that would be interested, is that probably might be an option to look into, because like I said, they weren't really taking in people with clinicals during COVID, and they were hiring them as care partners. But I think they might be starting to lift restrictions, but I don't know the status on that. But those, when they're called ACPs, they're posted year round. So
Great. And they have to be in the program, or could they be pre-nursing students?
they do have to be currently enrolled in a BSN program.
Okay, thank you.
Crystal,
Yes.
what I encourage students to do when they're networking too is to look for a job. Let's say you wanted to work at MCR, and let's say you wanted to eventually be a surge tech at MCR. That's great, but you haven't gotten into a program yet. You're not in surge tech. My encouragement always comes from, please find a job at MCR. Like, find a job in nutrition, find a job as a transporter, find a job in registration, find a job at MCR that you are qualified for, and start networking, right? And then you come to Ames and you go through your surge tech program, or you go to Front Range and go through the surge tech program, and you are already employed at MCR. Maybe not doing your dream job, but you put in a couple years there doing something else and meeting a lot of people. And then when you get your surge tech certification, then you've done a lot of that networking already. So look for places of employment, look for opportunities where they are. And it might not be what you want to do forever, but it might be something to get some good experience, to get to know the culture, to get to know a lot of people who can help you get to where you eventually want to be.
That's great advice, Erin. Thank you for sharing that. That's so important. And especially for somebody who works with students that are looking for part-time employment, really making that connection of, where do you want to work? What skills are you wanting to develop? Thinking about that in terms of your part-time employment,
Right.
or full-time employment as you're going to school, is important. Thank you.
And I don't know if Anna can speak on UC Health, but I know UC Health and Banner, and that's just primarily what we have up in North, right? I'm sure there are lots of facilities that do this, but have some scholarship opportunities for students in healthcare. So there are a lot of benefits of working in healthcare, even doing other things.
Yeah, I agree. And I know there's a lot of people who are studying some, in a completely different area, and they're basically getting their foot in the door. And like, I agree that that's one way to get your foot in the door. And sometimes some managers will look internal when they want to start hiring someone. But yeah, that's a great way to start networking, is to maybe find just an entry-level position to get your foot in the door and get to know the culture, and get to know the managers. Because when I have current employees that call me and they're interested in a whole different area, then that's basically my advice to them, is start to get to know those managers in your field of study and start networking, and let them know that you're interested. And then it's also probably, and during this time, it would be easier to go shadow that department as an employee than it is as an external because of COVID. So it's easier to go in because you're already an employee. So you can definitely go and shadow anytime, any department that you want.
That's really good advice. Thank you. Chris, do we have any additional questions at this time?
Couple that I answered directly. So
Okay.
we're doing well. Thank you.
We're good. So Lisa, I'm curious in terms of your path of making a decision to go into speech and language pathology. Can you kind of talk a little bit about what helped you make the decision and as it relates to work-based learning, or just walk us down your path of why this occupation? What about it?
Oh, goodness. Well, I was one of those strange kids that just had to know what my path would be. So I actually took some aptitude tests in high school that suggested that this might be a good field for me. And I had a nephew actually who was a stutterer. And he had gone to a speech pathologist, and it had really, really helped him. Just really quite amazing. And so I became interested. Initially, I thought I was going to work with children. And the wonderful thing about speech pathology, it is a very wide field, and there are actually many different areas that you can go into with it. And I discovered that I'm not actually so great working with kids, but I love the grown-ups. I love geriatrics. And as soon as I did my internship, I thought, oh, this is it. This is really speaking to me. So I really encourage you people to really take advantage of the internships and look for places that will give you a large variety of clientele to have experiences with, because that's going to help you figure out which direction you want to go. But like I said, I don't think you're ever stuck with speech therapy either. If you've started off working in one area, you always have the opportunity to learn something new and go focus in a different area. It can be very specialized, actually. And I think I've ended up specializing in the more medical side of speech pathology, but it's really been fun. It's been a great field. I've never regretted it.
Thank you, Lisa. Really appreciate that. Katie, Erin, same question. Why sterile processing? What led you to this industry, and as it relates to work-based learning, was there any moments that helped you make that decision?
I have just always been obsessed with the human body and anatomy and physiology and how everything works. And, the human body is an amazing, thing, and how it can repair itself. And, originally I wanted to be like a forensic pathologist, but when that didn't really work out, I actually had a friend that was a surgical technologist. And so I thought, hey, why not? And I enrolled in the program, and I actually graduated from the program that I now run, which is kind of crazy. But it was just an amazing experience, and to, get to see the human body and all these different forms, and, and fix it when people are sick, and be part of that is just extremely rewarding. And sterile processing is, the facility cannot run without sterile processing. They really are the backbone of a lot of different units, and, we couldn't do what we do without them.
Thank you, Katie.
So my background is not in sterile processing or surge tech. I have my master's degree in public health. And so my passion has always been building relationships and working on community health things. And so I kind of fell into working at Ames about 8 years ago. I worked for Banner for 15 years teaching childbirth classes and breastfeeding and things, parenting classes to new parents. And but educating people and working with students, really, I love it. And kind of living vicariously through them, finding all these experiences is really fun.
Great. Thank you, Erin. So my next question just has to do with, I guess, the application process. So I'll start with Anna for this, but would love to hear all of your thoughts. Like, what are some of the things you're looking for when you're reviewing applications for internships or apprenticeships? And what are some things that students should consider in terms of preparing those pieces when they're considering applying to internships, apprenticeships, and even part-time employment, or I guess all employment, we'll go with that. But the focus here is internships and work-based learning.
When I'm looking at an application, I really look for like detail-oriented people, make sure that everything is spelled right. Our application process, it does have an option that it can auto-populate from your resume. Unfortunately, it doesn't always auto-populate in the right sections. So I think to go back and make sure that that is all correct, because I have seen applications where, their first name is Fort Collins, or, so I think so that to make sure that they go back and make sure that their application is correct and they have those detail oriented. I think that's one of the first things. And then also, just not having misspelled words, and then also having a cover letter also helps, to really, that is specifically for that position. Sometimes when someone applies, you can tell that it's just a general application and they're applying to anything. And really, even though if it's an entry-level position, just be, kind of honest and just have a cover letter and say, why do you want this position, and why do you meet those requirements, and why are you the best person? I think adding that to the application really tells their story to the hiring manager on why we should consider them. But I think my major thing is being just detail oriented, because I would have to say that it's probably the number one error that people make.
Great. Thank you, Anna.
Mm-hmm.
Anyone else have some tips or things to consider when applying or thinking about applying to internships or apprenticeships?
I think what I've told people who don't have any experience in healthcare and they're wanting to get into healthcare, either you're 18 years old and just out of high school and just starting college, and you just don't have a lot of experience yet, and that's okay. You have to start somewhere. But it would be interesting, nobody has their cameras on in the audience, but it would be interesting to see how many people have worked in customer service. And healthcare is a lot like customer service. It is customer service. And so even if you have worked at Taco Bell or Starbucks or some other industry where you have dealt with customers, to bring some of those skills out and apply them to healthcare. Are you good at anticipating people's needs? If you've waited tables, yes, you are. You've gotten really good at that. Are you good at multitasking? You are. Are you good at remembering? You have a good memory for taking orders and not writing things down and this and that, or getting to know the same people over and over again by name. If you haven't had any healthcare experience, but you've had experience in other jobs, I think if you can pull out those customer service details and apply them to the job that you want, what has customer service taught you and how will you apply that to giving great patient care? Those are things that I would suggest if you're just new and starting out.
I love that, Erin. We tell our students all the time to tailor your resume, and and the attention to detail is extremely important as well. So thank you both. Anyone else? Any tips or things to consider?
I think that was a great answer about thinking about some of the other jobs that you've had and what kinds of things that you can apply from that. Because I waitressed for years. And let me tell you, there's a lot of waitressing that goes into therapy. It's amazing. So, yeah, some of those skills, it just comes right back.
Definitely. Thank you. Chris, do we have any questions? Any?
No, Crystal, I did put the Survey Monkey. It's just a survey on thoughts about the chat and to give us some feedback. So I put that in the chat there.
Great. Thank you very much. We would love your feedback. I guess as we're nearing the end, my last question, and it's for everyone, is any information that we didn't cover today focused on work-based learning internships that you would like to tell this group? Anything that we didn't cover that is coming to mind for you?
There's, I know this last year's been different, but also when we talk about networking, I would also recommend like attending career fairs. You know, when we do go back to normal and you are able to see people in person, I would recommend looking or going to those career fairs, because that is perfect for networking, because then you can see you talk to the recruiters in person. And I know you know, Julie Willis, who's our RN new grad recruiter, and she remembers those people, and they when they're ready to when they've graduated and they're applying for jobs, and she knows that name. Oh yeah, I remember talking to this person in a career fair, they were great, you know. But just using those soft skills and those skills that you have in communication, and making that first impression really helps you, even talking to a recruiter at a career fair. And then, you know, Julie could be that voice to those hiring managers and say, hey, I talked to this person, they were great.
Thank you, Anna.
Mm-hmm.
It's good advice. And currently we're in the process of virtual career fairs, so definitely take advantage of those too. But those in-person fairs we definitely miss.
We do, yes.
They're great.
Not the same.
For sure. Anyone else? Is there anything that we didn't discuss that you'd like to share with the group?
I think for all students, just show initiative, and everything we've talked about today will show that by volunteering or job shadow or career fairs or getting a job within the company first at an entry level and then moving around. Just showing that eagerness and that commitment and dedication and willingness to learn is really important.
Thank you, Erin. Lisa, Katie. Joyce? I seen Joyce.
I do think work-based learning for any type of therapy discipline. I know there's a lot of academics involved there, but I think you've all hit on great points on getting a value of working in a job role, customer service, attention to detail. It is a long process to get that where Lisa's at right now, but I do think the more you put yourself out in different environments, you're going to figure out what specialty you would end up in potentially. And I know that colleges have a lot of good evaluations of, you know, where your talents and trades lie, but I do think take advantage of everything. There are so many services out there that sometimes people get overwhelmed with them, and then they don't take advantage of any of them, and then they get lost. So I do think take advantage of any connection that you have at the college level. Go for it. So
Thank you, Joyce. Thank you, Lisa.
Thank you.
I agree. Definitely find your passion. You know, life is too short to work in a job that you're miserable at. So find your passion and follow that, you know, network, reach out, and there is no replacement for the real deal. So, you know, getting to do a program where you get that hands-on experience and learning before you're just, you know, thrown to the wolves when you start is an amazing experience.
Thank you, Katie. And I would say it also helps you realize if you really do love it or not. I think Lisa was talking about realizing from the internship and the experience of really loving to work with the adult population as opposed to working with children. So I think it also has that perspective of, yes, I love this, but oh, no, I don't love this. And so the more you try it out, the more you get that experience, the more you're going to be able to make a better decision. And thank you, Joyce and Lisa, for talking about those assessments that you talked about your experience. I know in terms of career centers or, excuse me, counselors or folks on college campuses, typically it's in the career centers of college campuses. We do have assessments. So if you are exploring, if you're a student that's exploring, reach out. I feel like all of our college campuses, whether they be our community colleges or four-year colleges, have some resources to help you if you're exploring. So definitely take advantage of that. Thank you all. Thanks to all the panelists for such great insight and information today. We really appreciate your time and your expertise in sharing that with us. We will be recording this, or we are recording this, so this information will be on the NoCo Health Care Sector's YouTube channel. And then there is a survey, it's in the chat. There's a link to the survey in the chat. So please fill out that survey. We would love to know your thoughts. We're always trying to improve these panels and improve the information we provide to you as college students. So thank you all. Thank you to all the panelists. We really appreciate your time.
Thank you.
Thank you, everyone.
Thank you.